Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in today's video. This is of a young boy, aged 5, who attended with his father today. His father's an avid YouTube fan, subscriber, and his son unfortunately has been experiencing oral fullness, pressure, otalgia, so earache, and also reduced hearing. Visited the doctors and obviously was diagnosed with plugs of wax. Now, there's a family history of also glue ear, so the father was slightly concerned about whether his son had glue ear. Therefore, visited myself. The doctors did advise they would be able to syringe this after using drops for 2 weeks, but the father wanted it sorted ASAP, and therefore contacted myself. We had to condition the child. Very, very good, very still. I initially used a fine end suction gauge, so it's a bit less noisy, small ear canal, but it just wasn't powerful enough to remove that plug of wax and keratin. So I had to use the standard Zollner suction probe, and it came out much easier. I've now attached a fine end suction probe onto the Zollner suction probe, because this residual bit of wax and skin that was on the roof of the ear canal wasn't as it did, so it didn't need as much suction power. So the eardrum was intact, but it was slightly inflamed, slightly retracted. And this is the patient's right ear. And we noticed a lot of keratin there, and the wax is hardening. That's because of all the reflections. When you've got dead skin keratin and a hard plug of wax, you get a lot of reflection back from the endoscopic light. Again, eardrum's visible. It is slightly retracted, slightly inflamed as well. I'm just going to use a fine end suction gauge just to peel off this dead keratin around the edge. So the patient, we did do a pressure test called tympanometry. They do have what we call glue ear or acute otitis media with effusion. It's essentially catarrh fluid behind the eardrum due to a blocked eustachian tube. So there's a tube behind the eardrum called the eustachian tube. The eustachian tube connects to the back of the nose and nasopharynx region. And the function of the eustachian tube is twofold. It's the pressure equalizer in the ear. We want the air pressure behind the eardrum to be equal to the air pressure in the atmosphere. And it's eustachian tube that regulates the air pressure. When the air pressure either side of the eardrum is equal, that's when the eardrum is most mobile, most compliant, and it's best able to absorb sound waves and transmit it through the 3 bones to the organ of hearing, the cochlea in the inner ear. That eustachian tube is typically shut. But during brief moments of yawning, swallowing, eating, it opens and equalises the air pressure. However, if the eustachian tube gets blocked at the back of the nose, in the nasopharynx, all the air in the middle ear gets sucked in by the neighbouring cells, which means there's a vacuum of air eventually. The eardrum gets sucked in, and fluid that would normally drain out of the eustachian tube that's secreted by the middle ear can no longer drain, and it builds up behind the eardrum, and that can cause a hearing loss, and we call that glue ear. So treatments are, we've recommended some nasal drops for children, and they're non-steroid drops, and also the Otovent nasal balloon, which is designed to inflate the eustachian tube and widen it so the ear can equalise the pressure. And we've advised the patient there's no improvement to contact us in 7 days, and we'll send a referral to the GP, who will then need to refer to an ENT for possible grommets and or some other treatment. So they might have to look up the nose if there's any obstruction there. Sometimes children can have adenoids that grow and enlarge, and that can block the eustachian tube. So I hope you enjoyed that video, guys. Take care and speak to you soon.